Close your eyes and find a comfortable position. Take a deep breath in through your nose and slowly exhale through your mouth. Let your body settle into complete relaxation as we embark on a journey through the muscles of your lower extremity. With each breath, you'll not only relax, but also connect with and memorize the intricate anatomy of your legs. Beginning the journey. Feel your body sinking into comfort with each exhale. Now gently direct your attention to your hip region. Imagine warmth and awareness flowing down from your core into your hips, thighs, and legs. You are about to explore each muscle, feeling its location, understanding its connections, and memorizing its purpose. Hip region, the foundation. Let's begin with the powerful gluteus maximus. Feel the large, broad muscle spanning across the back of your hip. The gluteus maximus originates from the ilium, which is the large, flared part of your hip bone, the sacrum at the base of your spine, the coccyx or tailbone, and the sacrotuberous ligament. This mighty muscle, the gluteus maximus, inserts into the gluteal tuberosity of the femur and the iliotibial tract that runs down the side of your thigh. The gluteus maximus is innervated by the inferior gluteal nerve. When this muscle is weak, climbing stairs or rising from a chair becomes difficult. Feel the strength and power of your gluteus maximus. Now shift your awareness to the gluteus medius, This fan-shaped muscle sits on the lateral aspect of your hip. The gluteus medius originates from the outer surface of the ilium, that broad hip bone. It inserts into the lateral aspect of the greater trochanter, which is the bony prominence you can feel on the side of your upper thigh. The gluteus medius is innervated by the superior gluteal nerve. Remember that weakness in the gluteus medius causes the Trendelenburg sign, where the pelvis tilts when walking. Feel the stabilizing presence of your gluteus medius. Deeper still lies the gluteus minimus. This smallest of the gluteal muscles originates between the anterior and inferior gluteal lines of the ilium. The gluteus minimus inserts into the anterior aspect of the greater trochanter, that same bony landmark on your lateral hip. Like its neighbor, the gluteus minimus is innervated by the superior gluteal nerve and assists in maintaining proper gait. Sense the subtle but important work of your gluteus minimus. Deep within your pelvis, find the piriformis muscle, the piriformis. This deep muscle originates from the anterior surface of the sacrum, the triangular bone at the base of your spine. The piriformis inserts into the greater trochanter of the femur. It receives innervation from the nerve to piriformis. Clinically, remember that the piriformis can compress the sciatic nerve, causing piriformis syndrome. Feel the deep rotation and precision that the piriformis provides. Anterior thigh, the powerful extensors. Move your awareness down to the front of your thigh, where the mighty quadriceps muscles reside. First, locate the rectus femoris. This muscle stretches from your hip to your knee, originating from the anterior inferior iliac spine, that bony prominence at the front of your hip. The rectus femoris inserts into the tibial tuberosity via the patellar ligament, connecting to that bump just below your kneecap. It receives innervation from the femoral nerve. Because the rectus femoris crosses both the hip and knee joints, it's commonly strained in sprinting activities. Feel this dual action muscle along the front of your thigh. On the outer aspect of your thigh lies the vastus lateralis, This muscle originates from the greater trochanter and the lateral linea aspera, which is the rough ridge on the back of your femur. The vastus lateralis inserts into the tibial tuberosity through the patellar ligament and is innervated by the femoral nerve. This muscle provides crucial lateral support to your knee. Sense the strength of your vastus lateralis. Medially, discover the vastus medialis. The vastus medialis, it originates from the intertrochanteric line and the medial linea aspera of the femur. The vastus medialis inserts into the tibial tuberosity via the patellar ligament and receives femoral nerve innervation. The vastus medialis oblique, or VMO, is particularly important for proper patellar tracking. Feel the medial stability provided by your vastus medialis. Hidden beneath the rectus femoris lies the vastus intermedius. The vastus intermedius. This deep muscle originates from the anterior shaft of the femur. The vastus intermedius inserts into the tibial tuberosity through the patellar ligament and is innervated by the femoral nerve. Together with its three companions, the vastus intermedius forms the powerful quadriceps group. Sense the deep support of your vastus intermedius. Crossing diagonally across your thigh like a ribbon is the sartorius. The sartorius. This longest muscle in your body originates from the anterior superior iliac spine, the bony point at the front of your hip crest. The sartorius inserts into the medial surface of the tibia as part of the pes anserinus, the goose foot, where three tendons come together. It receives innervation from the femoral nerve. Known as the Taylor's muscle, the sartorius allows you to sit cross-legged. Feel this elegant diagonal line across your thigh. Medial thigh, the adductors. Turn your attention to the inner aspect of your thigh, where the adductor muscles draw your leg toward the midline. Begin with the adductor longus, the adductor longus. This muscle originates from the body of the pubis, that central part of your pelvic bone. The adductor longus inserts into the middle third of the linea aspera on the back of your femur. It receives innervation from the obturator nerve. Groin strains commonly affect the adductor longus. Feel this important muscle along your inner thigh. Slightly deeper lies the adductor brevis, the adductor brevis. This muscle originates from the inferior pubic ramus, the lower branch of your pubic bone. The adductor brevis inserts into the upper third of the linea aspera and is innervated by the obturator nerve. Positioned beneath the adductor longus, the adductor brevis provides additional medial thigh strength. Sense the layered support of your adductor brevis. The most powerful of the adductors is the adductor magnus, the adductor magnus. This large muscle has a dual origin from the pubis and the ischial tuberosity, that bony prominence you sit on. The adductor magnus inserts into both the linea aspera and the adductor tubercle on the medial aspect of the femur. Uniquely, the adductor magnus receives dual innervation from both the obturator nerve and the tibial portion of the sciatic nerve. Feel the substantial presence of your adductor magnus. Running like a strap along your inner thigh is the gracilis, the gracilis. This slender muscle originates from the body and inferior ramus of the pubis. The gracilis crosses the knee joint and inserts into the medial surface of the tibia as part of the pes anserinus, joining the sartorius and semitendinosus tendons. It receives innervation from the obturator nerve. Feel this graceful line of muscle along your inner thigh and across your knee. Posterior thigh, the hamstrings. Direct your awareness to the back of your thigh, where the hamstring muscles provide power for hip extension and knee flexion. On the lateral side lies the biceps femoris, the biceps femoris. This muscle has two heads. The long head originates from the ischial tuberosity, while the short head arises from the linea aspera on the back of the femur. The biceps femoris inserts into the head of the fibula, that smaller bone on the outer side of your lower leg. The long head receives innervation from the tibial portion of the sciatic nerve, while the short head is innervated by the common fibular portion. As the lateral hamstring, the biceps femoris is crucial for knee stability. Feel this powerful muscle along the back and outer aspect of your thigh. Medially, find the semitendinosus, This muscle originates from the ischial tuberosity and is characterized by its long tendon, giving it its name. The semitendinosus inserts into the medial surface of the tibia as part of the pes anserinus, joining the sartorius and gracilis. It receives innervation from the tibial portion of the sciatic nerve. Feel the semitendinosus along the medial back of your thigh. Beside it lies the semimembranosus, This flat, wide muscle also originates from the ischial tuberosity, but inserts into the posterior medial aspect of the tibia. The semimembranosus is innervated by the tibial portion of the sciatic nerve and plays a crucial role in knee flexion and medial rotation. Feel the broad support of your semimembranosus. Together, these three muscles form the powerful hamstring group that propels you forward and stabilizes your knee. Anterior lower leg, the dorsiflexors. Move your awareness down to the front of your lower leg, where muscles lift your foot and toes. Most prominent is the tibialis anterior, This muscle originates from the lateral surface and upper portion of the tibia, the larger bone of your lower leg. The tibialis anterior inserts into the medial cuneiform and the base of the first metatarsal on the inner aspect of your foot. It receives innervation from the deep fibular nerve. Weakness of the tibialis anterior causes foot drop, making it difficult to lift the front of your foot. Feel this important muscle along the front of your shin. Beside it runs the extensor hallucis longus, This muscle originates from the middle portion of the fibula and the interosseous membrane between the two lower leg bones. The extensor hallucis longus inserts into the distal phalanx of the big toe, the hallux. It receives innervation from the deep fibular nerve and is responsible for extending your big toe. Feel this muscle's connection from your lower leg to your big toe. Next to it lies the extensor digitorum longus, This muscle originates from the lateral condyle of the tibia, the upper portion of the fibula, and the interosseous membrane. The extensor digitorum longus inserts into the middle and distal phalanges of toes 2 through 5. It receives innervation from the deep fibular nerve and extends your smaller toes. Sense the connection this muscle provides to your toes. Often present is the fibularis tertius. This small muscle originates from the lower third of the fibula and inserts into the base of the fifth metatarsal. It receives innervation from the deep fibular nerve and assists in eversion of the foot. Note that the fibularis tertius is sometimes absent. Feel for this small muscle on the outer front of your lower leg. Lateral lower leg, the evertors. On the outer aspect of your lower leg, discover the fibular muscles. The fibularis longus originates from the head and upper portion of the fibula. This muscle has a remarkable course, with its tendon traveling under your foot to insert into the base of the first metatarsal and medial cuneiform. The fibularis longus receives innervation from the superficial fibular nerve and is crucial for maintaining your foot's arch and providing eversion. Feel this muscle's long journey from the outer leg to the inner foot. Beneath it lies the fibularis brevis, This muscle originates from the lower portion of the fibula and inserts into the base of the fifth metatarsal on the outer edge of your foot. The fibularis brevis is innervated by the superficial fibular nerve and assists in eversion. A Jones fracture of the fifth metatarsal can affect the fibularis brevis insertion. Feel these muscles awakening along the outer aspect of your lower leg. Posterior lower leg, superficial layer. Turn your attention to the back of your lower leg, where the powerful calf muscles reside. Most superficial is the gastrocnemius. This two-headed muscle originates from the medial and lateral femoral condyles, the bony prominences at the bottom of your thigh bone. The gastrocnemius joins with the soleus to form the Achilles tendon, which inserts into the calcaneus, your heel bone. It receives innervation from the tibial nerve. The gastrocnemius is your explosive movement muscle, crucial for running and jumping. Feel the power of your gastrocnemius. Beneath the gastrocnemius lies the broad soleus, the soleus. This muscle originates from the posterior aspects of the tibia and fibula. The soleus joins the gastrocnemius to form the Achilles tendon, inserting into the calcaneus. It receives innervation from the tibial nerve. Unlike the gastrocnemius, the soleus is primarily a postural muscle, working constantly to maintain your balance. Feel the steady support of your soleus. A small muscle called the plantaris, originates from the lateral femoral condyle and has a long, thin tendon that inserts into the calcaneus alongside the Achilles tendon. The plantaris receives innervation from the tibial nerve but is sometimes absent. When present, it provides minimal assistance to the larger calf muscles. Allow any tension in your calf muscles to release. Posterior lower leg, deep layer. Deeper in the back of your lower leg, discover the muscles that support your foot's arch and flex your toes. The tibialis posterior originates from the posterior surfaces of the tibia, fibula, and interosseous membrane. This crucial muscle inserts into the navicular bone and has additional insertions into the cuneiforms and metatarsals, supporting your foot's medial arch. The tibialis posterior receives innervation from the tibial nerve and is essential for maintaining proper foot mechanics. Feel this deep support for your arch. The flexor digitorum longus originates from the posterior surface of the tibia. Its tendons travel to insert into the distal phalanges of toes 2 through 5. This muscle receives innervation from the tibial nerve and flexes your smaller toes while supporting your foot's arch. Feel this muscle's connection from your lower leg to your toes. On the lateral side of the deep posterior compartment lies the flexor hallucis longus. This muscle originates from the posterior surface of the fibula, and its tendon inserts into the distal phalanx of the big toe. The flexor hallucis longus receives innervation from the tibial nerve and is particularly important during the toe-off phase of walking and running. Feel this powerful connection to your big toe. Finally, the small popliteus muscle, the popliteus, originates from the lateral femoral condyle and inserts into the posterior surface of the tibia. The popliteus receives innervation from the tibial nerve and serves to unlock the knee by initiating knee flexion from full extension. Feel the back of your knee softening as you imagine this muscle at work. Intrinsic foot muscles, the foundation. Now direct your attention to the muscles within your foot itself. The flexor digitorum brevis. The flexor digitorum brevis originates from the calcaneus, your heel bone, and inserts into the middle phalanges of toes 2 through 5. This muscle receives innervation from the medial plantar nerve and helps support your foot's arch while flexing your toes. Feel this muscle supporting your foot from within. Along the medial aspect of your foot runs the abductor hallucis. This muscle originates from the calcaneus and inserts into the medial aspect of the proximal phalanx of the big toe. The abductor hallucis receives innervation from the medial plantar nerve and helps stabilize your big toe while supporting your medial arch. Feel this muscle along the inner edge of your foot. The flexor hallucis brevis originates from the cuboid and lateral cuneiform bones and inserts into the proximal phalanx of the big toe through its medial and lateral heads. This muscle receives innervation from the medial plantar nerve and provides fine control of big toe flexion. Feel the precise control this muscle provides to your big toe. Integration and completion. Take a deep breath and imagine your entire lower extremity as one integrated system. From the powerful gluteus maximus at your hip to the delicate intrinsic muscles of your foot, each muscle has its origin, its insertion, its nerve supply, and its unique function. Visualize the origins anchoring each muscle to bone, providing stable foundations for movement. See the insertions where muscles pull on bones to create motion. Imagine the nerves as pathways of communication, carrying signals that coordinate precise, purposeful movement. Feel the clinical significance of each muscle, understanding how weakness or injury affects function. Your body remembers this anatomical journey. Your mind has traced each pathway, felt each connection, and understood each relationship. The gluteus maximus, gluteus medius, gluteus minimus, and piriformis stabilize your hip. The rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius extend your knee. The adductor longus, adductor brevis, adductor magnus, and gracilis draw your leg toward center. The biceps femoris, semitendinosus, and semimembranosus power your stride. The tibialis anterior, extensor hallucis longus, extensor digitorum longus, and fibularis tertius lift your foot. The fibularis longus and fibularis brevis stabilize your lateral foot. The gastrocnemius, soleus, and plantaris provide explosive power. The tibialis posterior, flexor digitorum longus, flexor hallucis longus, and popliteus work deep within to support and flex. The intrinsic muscles of your foot, including the flexor digitorum brevis, abductor hallucis, and flexor hallucis brevis, provide the fine-tuned control that makes each step possible. You are ready, you are prepared. Your body knows and your mind remembers. When you're ready, slowly open your eyes, bringing this knowledge with you into your studies and your practice.